and we also have Kevin Duffy, our Business Development Officer. They're joined by Ron Cochran, of course, our Communications Director, and it never goes without fail that we also take a moment at the beginning of the show to thank Malden Access Television for having us and for being able to bring this show to you on a weekly basis. So just a couple of quick updates, and then we'll get over to Mr. Magner and Mr. Duffy for brief opening statements. And then, as always, we want to hear what's on your mind. So Mr. Magner will talk about the number of cases and, unfortunately, the number of deaths. And then Mr. Duffy will talk about phase 2 of Governor Baker's reopening of retail establishments as well as restaurants as it pertains to outdoor dining. Just a quick note, all city buildings remain closed. And if you do need to reach us, 781-397-7000. Now, most of our employees started returning to work following, all of the protocols that have been laid out by the state. We're now waiting to determine whether we can open to the public and when. So we will let you know that. But in the meantime, if anything comes up, please contact us at 397-7000. The other thing of note relative to the city, we are going to be moving into our new city hall this month. Obviously, we wanted to have the entire community in, but we're not quite there yet. But we will let you know at a future date where we can do some tours and let you see the fantastic work that's been done by a lot of people, most notably Ron Hogan, who's been heading up that project. One other note is, as for parks, we will be opening parks for the weekend. We're getting them ready now. Now, the way the order reads from the state, it will be a buildup of the previous order or protocol, which is it's geared toward passive recreation. So in other words, this weekend will not involve contact sports. So I think the things we see opening up are the dog park, the skate park, tennis, those types of activity where there's not a lot of contact. So I know a lot of our hoop players are disappointed, as I just went back and forth with them on Instagram, but we're just, again, we don't want to go back to where we once were in March. So we're trying to be extra cautious, and it's what the state is recommending to us as well. Our point person on that, if you have any questions, you can contact Joe Levine at 781-397-7168. So without further ado, we're going to go to Mr. Magner first. Again, she'll talk about where we are for cases. She'll talk about the continued importance of testing. And then we'll jump over to Mr. Duffy, who will talk about where we are with some of our restaurants coming back online. So, Mr. Magner, welcome.
Hi, thank you, Maya, and it's a pleasure to be here again. Today we did our numbers as we do, and we are up to 1,169 cases in the city of Malden. Our number of reported deaths are 78. Unfortunately, I will always say that the numbers are not exact. It's not an exact science. The Maven reporting system that we use wasn't developed for the numbers to be exact. It's not a counting number. It's a reporting and surveillance system. So they are doing their best to have the numbers be as accurate as possible, but they're doing pretty well with keeping track. So that being said, that's the best number that we have so far. We are, unfortunately, the school nurses are going to come to an end at the end of their helping with us. I have to give them a huge shout out and thank them very, very much for all the hard work that they've done in assisting me and the whole department in the contact tracing that we've been doing. Patty Tremendozi, the nurse supervisor, has been just so valuable, and her staff. We're going to really miss them. We've always had a great working relationship, but this has just been, they've just been so valuable. So we will miss them. But luckily, they're leaving at a time when it seems to be, the curve is definitely flattening. So we will carry on. We've, the Cambridge Health still has that drive-through testing area that anybody can go to. We really encourage asymptomatic testing to be done. Currently, we've had about 5,920 people be tested. That is only 20% of our population. It would be great for people to go out and get tested, so we have a better understanding of what the number is like in our city, so we can better gauge how stage 2 and stage 3 are going to go for the opening of the businesses, restaurants, parks, everything that everybody wants to move ahead with. So I encourage people to go out and get tested. As far as the testing sites go, Cataldo Ambulance along with CHA and the health department are starting to set up appointments for COVID testing at the senior housing complexes. And that's going to start as early as next week. So that's encouraging. The first stop for senior housing testing is going to be 280 Salem Street. And
Okay.
so far, there's 25 people scheduled to be tested there.
Good.
That's a really big help for people that can't get out to the testing sites. So we think that we're going to get a lot of good information from Cataldo Ambulance Service going to the senior centers.
Okay.
So that's really it in a nutshell for
All
what we have. But again, thank you for having me, and we're just plugging away, and we're getting all the again, I would want to say one more thing. If you see a number come from the city, a city phone number, please answer it. Any information that you can give us is so helpful in, finding out all the information that we can for the State Department of Public Health as well as the CDC.
What would that number be, Mr. Magna? 78.
It's the city number, any 781-397-7000 number, or with any other two numbers after it. If you see that come up, City of Malden number, please answer it, and take the time, maybe 10 or 15 minutes to answer our questions. It will just help enormously with any of the research that's being done with this new virus.
Okay, and Mr. Magna, before we forget, if people want to reach you after the show, what's the best phone number and email address?
So it's mtamagna@cityofmalden.org. That's really the best way to reach me. The phone numbers are busy, and I get about 80 phone messages a day, but my direct line is 781-397-7052. I do my best to answer the messages at the end of the day.
Okay, and if someone wants to make an appointment with Cambridge Health Alliance to be tested, do you have that number nearby? I have it, Mr. Magna.
Thank you. I do. Go ahead.
617-665-2928. Call Monday through Friday, and they're pretty good on getting people in. So, as Mr. Magna said.
Yes, the testing site, I hear, goes very smoothly. Getting your results takes a bit longer than they say. If the test result is positive, you will know immediately as soon as they get the results done, usually within 48 hours maximum. If the test result is negative, it takes a little bit longer. I ask people to please be patient. But if it's positive, you will find out very quickly.
Okay. All right. Thank you once again. Now let's jump over to Mr. Duffy. He'll make a brief statement, and then we'll get on to the questions.
Thank you, Mr. Mayor. Appreciate the opportunity. So I know it's been a very long haul. The businesses have been shut down for quite a while, and it was just a very tough time. But I hope people can start to feel the energy. You're starting to see openings happening. You're starting to see activity, more people in the square, exhibiting safe behavior, but you're starting to feel that energy. So I have a lot of great things to share with everyone when we come back to me later in the show. Thank you.
All right, great. All right, we're at the point of the show now that we put you both in the web, and that's where I get to ask you any question I feel like asking you, and you can't avoid answering it. This is a segment that we've taken from the hit show Around the Rim, hosted by nationally acclaimed Nestor Dudley. You can Google it. I think he has his own podcast now. So anyway, Let's ask the first question to Mr. Duffy. So, where is the first place you're going to go for outdoor dining?
Well, Mr. Mayor, I'm probably going to divide the family up and have us all go to different locations just so that we can spread the wealth, But there are a lot of great opportunities out there. As you know, we've had some patios in Malden the last few years, great outdoor seating opportunities. But this year, because of what's been happening, we have put together an expedited outdoor seating application. So businesses that normally don't have outdoor seating, they can apply. We have a quick turnaround and we can get them set up so that they can have customers.
Okay, very good. Mr. Magna, let me ask you this. You said at the beginning, we have roughly, I think you said 1169.
Yes.
Is that where you thought we would be today, or did you think it would be worse or lower?
Mr. Mayor, that's a great question. I think it's right around where Chris Webb and I had thought that we were going to be. I wish it was lower, but yeah, it's right where we thought it would be.
And you don't see us being within range of being deemed a hotspot. We're far from that category, right? With 1169.
I don't think it's enough to be considered a hotspot. I don't think so.
Okay.
But it's high enough that it's keeping us busy.
Got it. Okay, very good. All right, well, you're both out now, so let's get to the questions. Mr. Cochran.
Yes, of course, Mr. Mayor. You know where we're going. Our first guest of the evening is Patty. She's on the line right now. Patty, go ahead. You are on the air with the panel.
Hey, Patty. Good question. Yep, you're not alone. We've had other people call us. Let me jump over to Mr. Yeah. Yeah, well, I know they've been doing a lot of their services online. I don't know if your neighbor is online. Yeah, they've been doing a lot online, but let me jump over to Mr. Cochran to see if we do have a date as to when they'll be fully back up and running.
Yeah, I'm going to research that for Patty. I don't have that right offhand, but it looks like Mr. Duffy might have a response for us.
All right.
I keep all this information up there. So the state guidelines came out May 1st for curbside pickup, but they have not been named as one of the industries that can reopen yet. So that is still up in the air, and we're waiting for the governor to declare that.
Yeah, and Patty, if we find out anything else during the show, we'll announce it. Okay? All right.
Yeah.
But in the meantime, they have been doing quite a bit online. So if you have access to that, let us know off air, and we'll try to get you the best ways to reach them. And you could just go through their website, which is Mr. Cochran. Do you have that nearby?
Yeah.
Yes,
website.
I do. It's www.maldenpubliclibrary.org, and it looks as though they've reached. Yeah, go ahead. I'll wait for it, Patty.
Library.org.
Yeah, a lot of great information there, and it looks as though they've geared the front page of the website very much towards online resources, which makes sense. It's great. So online library card. I know personally I've participated.
Yeah, I have a
in
library card already.
Yeah.
So
Yeah.
It makes it real easy, Patty.
Yeah, but I need a book to take out for my kid, Hazel, from Elliott. She gave me a lot of worksheets to work on, like think positive, think like not negative thoughts, something like that. Book it would help me.
Well, I know she didn't tell you to stay busy because you already do that. So
Yeah.
that's another good one. But check the website, Patty, and then just keep tuning in, and we'll try to get you more information as it happens.
All right.
All right, Patty.
Thank you.
All right, great.
Thank you.
Thanks as always to Patty. We always enjoy those questions. Our first question from the web, or actually before we get to our questions, we do want to remind everybody that the different ways that you can reach us tonight. The first is going to be by messaging our Facebook account. So that's primarily where I'm looking for questions. That's facebook.com/City of Malden. And of course, this YouTube live stream that's being put up by Malden Access Television, I'm also looking in there for questions. And then, of course, if you wanted to shoot me an email, it would be info@cityofmalden.org. So I'll be looking for questions, but I do have a couple here up front that we can get to. The first question is in regards to restaurants. We'll go right back to Mr. Duffy on this one. Question is, what restaurants are participating in outdoor seating?
So we have our traditional outdoor seating ones that I mentioned at the beginning. So those are places like Hugh O'Neill's, John Brewer's Tavern down on Highland Ave. You also have District Kitchen right next to the Malden train stop, and then Pizza Pizza. They have a great patio as well. But because of what we've done with the Malden Licensing Board and a bunch of department heads, we've been able to expedite this new application, and we've had 5 businesses take advantage of it so far. And those are John Brewer's, who did a greatly expanded patio next to their old one. The Irish American now has outdoor seating, but Pearl Street Station has created an entire outdoor barbecue right on Summer Street in their parking lot. Parking still in the deck in the parking lot across from the courthouse. And then Three Amigos right on Main Street, right at the corner. They have outdoor seating along Main and Irving. And then the big news, because it was the grand opening today, Faces Brew Pub is now officially open, and they are open to their back lot where they have fenced it in, set up 12 picnic tables, and people are just coming out. Today was a banner day for them. But I got to stress, everyone's doing it the right way. The only way to do this is the safe way. So we're making sure these businesses are doing it. They are, and so the customers are responding.
Yeah, Mr. Duffy, there might be one more soon, right? And that's Mystic Station, thanks to Malden Access Television. Is that right?
That is correct. MATV has, as they often have, gone above and beyond to help the community. And this time it's a direct neighbor. And so they've allowed Brian to apply for seating out in front of MATV as well as his spot. So we have Mystic Station applying as well as 4 others. So there'll be a new round of businesses next week that'll be opening with expanded outdoor seating.
So what do you think the name will be? Is it going to be like Muma now?
It might be more like the Ron Cox Memorial Table, put it that way.
All right, very good. Thank you, Mr. Cochran.
Our next question is in regards to contact tracing. So we heard so much about contact tracing early on, and I know Mr. Magna spoke on that with the public health nurses, or I'm sorry, the public school nurses that were assisting. The question is, what has contact tracing done to assist in flattening the curve, and how did that go? How has that been going for you guys?
So the thing about contact tracing is it identifies the people who have come in direct close contact with a positive case of the coronavirus. In doing so, those people who are identified are asked to quarantine for 14 days. Therefore, the thought process is that those people will not be spreading the virus if they in fact come in contact with it. If they had come positive, I'm sorry. And the latest guidelines from the state and CDC are now, because of the testing becoming more available, are suggesting that the people that are the close contacts get tested as soon as possible. Even if they test negative, they are recommended to stay in for the quarantine period. In doing so, that has helped stop the spread and flatten the curve, because those people, maybe 50%, 40 to 50% have become positive in the past, and therefore they don't pass the virus on further. The other thing that it does is once the person is identified as positive, if they truly isolate truly isolate within their home, it meaning staying in their own room, not sharing meals, having their own bathroom space, or disinfecting every time they do use that bathroom. Um, the families that truly do that, those close contacts are not becoming positive. So in reaching out and identifying those contacts, you're educating them on all the hygiene and really stressing that they don't go out, as well as limit the contact with the case. That helps to stop the spread.
So, Mr. Magna, you truly believe in it? You
I
think
truly believe in it.
some people have poo-pahhed it, saying that, hey, with 6.5 million people, contact tracing, what can it really do? But you've seen it firsthand that it has
Oh
helped.
yeah. Yeah, I really do. I think the education piece that goes along with it, I think most people who do speak with us, with the nurses, are very grateful. We often have to make more than one phone call, so we'll follow up with them. And they're grateful that to think that there's a person on the other end of the line who has some good information for them, that cares and calls back. We've had people that we've talked to, 4 and 5 times, and they're very grateful, to the advice that we can give them, or can quickly identify. Before the tests were so readily available, we were identifying another person in their family that may have it before they realized it.
Yeah.
And they were going out, they were seeking a doctor's appointment, an emergency room visit. So they were really grateful, I hate to keep saying the same word, that there was that connection with somebody in the community.
Mr. Cochran, on the first question, and I'm going to go back to Mr. Magna in a minute. We had a Metro Mayor's call on Sunday afternoon, and they had Dr. Walensky from Mass General, who I believe is the chief of infectious diseases there. So I asked the question, after 3 months, how much of the recovery was due to social distancing? How much of it was due to the weather getting better, the heat, the temperatures rising? How much of it was maybe us adapting to the virus? And without hesitation, she truly believed that the social distancing, all these measures that have been put in place, has enabled us to get from, that high of mid-April to where we are now. So you feel the same way, Mr. Magna? That's, I know a lot of people chide about social distance, they add it. You don't. You think it?
No, absolutely not. I think that was the key in flattening the curve. I mean, you hear too many of the experts all agreeing, that this was the way to flatten the curve, and this was the way to. The numbers that we saw peaking in the beginning were absolutely because of people's interaction.
Got it. Now, she also did say that, based on what's happening across the country, she believes if there will be a resurgence from that, she thinks we would see that in maybe 6 weeks. I thought she said 4 to 6 weeks.
4 to 6, I believe, is what we're looking at. Yeah.
We'll have to look at that. But yeah, so far so good. All right. So, Mr. Cochran, I think that covers both parts of the question.
I do. I actually will personally add one to that list too, and that is in terms of contact tracing. There are also efforts that organizations themselves can do to assist in that. And I experienced one of them, which was when I attended church this weekend. We actually had to register for the mass, and we were it was explained to us by the priest that the reasoning for that was that if there was an exposure, then they would know absolutely who was there in the building. So there's a lot of appreciation I think I have for our organizations that are also putting in and doing some of this preemptive work,
Right.
For making us safe. So kudos to St. Joseph's, Malden, but I think all the churches are following similar protocols.
Okay.
It
Good.
makes things so much easier.
Yeah.
Okay. Our next question is, businesses taken advantage of the CARES Act funding? What has been the process for that?
I'm assuming that question's for me. So
Do you know how
what
many
I've been able to,
Mr. Duffy? Do you know how many have applied?
I do not have that number offhand. What I have is anecdotal evidence and touching base with the businesses and finding out what's been going on. I do know that most, and I feel like almost all of them who applied ultimately ended up getting their money. And it was absolutely a lifeline or a bridge to get them to a point now where it's still dire straits, but because, as I mentioned earlier, the sun is starting to rise and we can feel the energy, they feel like they can actually get to the open point and try to go back to making money.
Mr. Duffy, what about the program that we're doing with the City Council and the Malden Redevelopment Authority? Has anybody applied just yet? I know they were working out the logistics, but.
Yep. Thanks to Debbie Burke and Alex Pratt of the Malden Redevelopment Authority, they put together that program, which was for smaller businesses, which were often overlooked or just missed the opportunity when the federal money came down. I know they had a number of applications that came, and today was the closing date. We made a point of blasting it out to every food establishment in the city. We used every social media element we have, from Twitter to Facebook to the new SUFA signs on the street. So we really got it out there, got the applications, and the decision process starts now.
Okay, and speaking of which, unrelated but related, on the rental assistance piece, we were able to accommodate every applicant who applied. So that's fantastic news. I know that's something that, again, the Malden Redevelopment Authority, the City Council, and our office have been working together on. So that's great news for residents that needed the help. All right, where do you want to go next, Mr. Cochran?
Yeah, sure. Our next question is from YouTube, and it's Pete Casso. Pete Casso asks, in every restaurant, do you have to call ahead to make reservations, or can you walk up for dinner service at these outdoor facilities?
All right, Mr. Duffy.
Thank you, sir. So most of the restaurants that are opening are asking for call aheads. It's not so much a reservation system, but you call ahead and let them know you're coming, and they can try to stagger out. Some of them are taking the reservations. It's got to be a question like John Brewer's Tuesday night. They had a wait of 45 minutes. So if you're going to walk up, you might just run into a line, but I think be patient and you'll get your chance to get in there.
All right, I think that answers that. And then as an aside, Pete Casso is the maestro of All About Malden on Facebook. So if you're not already signed up, please do so. You get lots of good information, sometimes before the city announces it. So thank you, Pete, for always caring about our city. All right, where are we going next, Mr. Cochran?
Well, Mr. Mayor, hot off the presses, just I reached out to Alex Pratt from the Malden Redevelopment Authority just to see if we could get a number. And it looks like we've had close to 50 businesses actually apply for it, which is great. It shows us that there was a lot of activity. But, you know, as he points out, we won't be able to serve all of those businesses. However, you know, if the demand is high as it looks to be, it would influence perhaps, you know, a second round or a way for us to apply for more funding. So, you know, as he points out, not to be discouraged by this, but as Mr. Duffy pointed out, those are being reviewed. And as more data comes in, I think Mr. Pratt's going to try to text me some information so I can provide it here this evening.
Okay. And thank you, Alex, for all your hard work and dedication.
Okay, the next question is, what do I do if I'm in contact with someone who has tested positive for coronavirus? Do I get tested right away, or do I wait a period of time?
Good question.
For me?
Mr. Magno, what do you think?
Yeah.
Yeah, so the new guidelines from the state is to get tested as soon as you can get an appointment. And the main thing is then to stay quarantined for the 14-day period.
So nothing's really changed on that front. It's been
The
like,
only thing that's changed is to get testing. But prior to that, we weren't testing. They weren't recommending the testing.
okay.
So just to clarify, if I was to be made aware that I had been in contact yesterday, I would go get tested ASAP. I'd try to go tomorrow if I could.
As soon as you were able to get an appointment, I'm recommending people call Cambridge. But prior to this, prior to the asymptomatic testing, there was quite a bit of criteria that you had to meet before you could get a test. So that's why we weren't testing people who were exposed. We were just quarantining them. Now you're asked to get a test and be quarantined, despite what the test shows.
All right, Mr. Magna, while we're on the topic, do you believe there are a lot of false positives out there?
I was reading an article, and they're really not sure. The one thing that the new debate is about, Mr. Mayor, about that is whether or not people are, if they're positive and asymptomatic, whether or not they are contagious. That's what the debate is. I'm not sure. One day the CDC says studies have shown that they're not contagious, and then they renege on it and say they are contagious. So, again, I can't stress enough to people, this is a new virus. We really don't know. So I think the best thing that we can do as the public is to err on the side of caution. A positive is a positive, and we're going to say that, it is a contagious disease. We know it is. So we're going to err on the side of caution, and we're going to go with what the recommendations are, the quarantine periods, the isolation periods, and just be safe. So that's the best advice I can give.
I understand too, they're making progress on how the test is administered, meaning make it a little less painful. You know my tolerance level, right?
Yeah.
I thought that was painful. That's why. Yeah.
I'm not surprised, Mr. Mayor. I know. I give you the flu shot every year.
I almost filed a claim. I mean,
yeah. It's
so are they making progress on an alternative way of determining whether or not you have COVID or no?
Well, no. Well, I mean, they do it. I don't think you'd like the alternative. It would be the blood test. So you'd have to have a needle.
All right, let's change topics. So, Mr.
I thought so.
What else do we have in the queue?
Well, maybe for some potential bribery, I might have to pull up the photo of you getting your flu shot several years back, which is etched in my memory permanently.
We're running out of time, Mr. Cochran.
Mr. Cochran, it's the same photo every year.
Same expression, different photo.
Absolutely.
Well, you know what, Ron, let's stay there for a second. Mr. Duffy, I'm just going to stay with Mr. Magna here for a second. So speaking of the flu shot, how's that all going to play out in the fall here? Should people be gearing up to get their flu shot?
Oh my gosh, absolutely.
So it's still applicable to COVID?
So the problem with the flu and COVID is that they mimic each other, right? So we're going to have a whole new, batch of people that are we going to be able to distinguish? Do you have flu or do you have COVID? So now you're going to have a flu swab and a COVID swab. Yeah. So let's do our best to protect ourselves against what we can. So we know we have a flu vaccine. Let's take the flu vaccine.
Okay.
Yeah. I mean, I've been a big advocate there's people that are going to be pro-vaccine and people that are going to be anti-vaccine. That's a whole nother issue that we're not going to go into.
When do you think the vaccine will be available, the flu shot? Same time frame? Fall, October, November, or?
I'm hoping November.
Okay.
I always hope. I'm always on I'm always optimistic that we'll get it early. I don't know. I mean, who knows with everything now?
Right.
But I hope they do get it early.
Okay. So, Mr. Cochran, let's swing over to our business development officer. What do you have in the queue for him?
Yeah, so is actually a great question out here, which is retail shops. So we did hear phase 2 was available for retail curbside. What's the feedback on that? What's the effect on the Malden businesses? Who's chosen to go that route?
Well, we're starting to see some people come back with that. It's got some regulations that I think people are still trying to figure out and get comfortable with. It's about 8 people per 1,000 square feet. So if you're a small spot, you really can't get a lot of people in there. So since Monday was really kind of the day that this could get going, I think we need maybe next week's show, we can talk about it. Need a little time to see how people adapt and adjust. just because they can open, not all businesses are choosing to do that. They also have to be concerned about their own health and how they're handling it.
Mr. Duffy, are there any businesses not coming back as a result of COVID?
Yes, unfortunately, right in the downtown, the Up Tea Hub that was there, they were struggling and they were trying to find some things, to make ends meet. This seemed to kill it. And unfortunately, the new Nana Bee that had opened up, which had a lot of great baby products and skincare products, this was just, the worst time for them. So they've closed permanently. We have a few other businesses that are, they were just trying to get their feet under them when this hit, and it will be a challenge for them to get people back in. But I think there's a lot of pent up demand up there. And if businesses can show their customers that they are putting their health first and foremost, and then sales, I think those customers will come back in, and we should be able to right the ship and go forward.
Kev, forgive me, because I know we have a few of the shops in the downtown. Is the shop you're talking about to the right of where we are now?
Correct.
Or is it across the street?
Nope, right to the right of where we are was Up Tea Hub and Nana Bee right there.
So
lovely people who had opened it, just didn't work out, unfortunately. Timing.
Yeah, okay. All right, Ron, who's next?
Well, we do want to just pop in some information here, and I really appreciate Alex Pratt being on top of this. He was sending me some information. So hot off the presses here, of the applicants, 37% of the applicants were minority-owned businesses, and 30% were women-owned businesses, which I think is fantastic. Of the 30% business owners who applied, 30% of the business owners were of Asian descent and 15% of African American. Basically, the overall number was about 65% non-white. And why that's important and why, I was discussing it is we did make extra effort to make these applications or the literature available in multiple languages. And Alex's thought on that is that it did work. The outreach is great. So it's helping all of our businesses from all facets. And so it's a good report.
Well, tell Mr. Pratt, he better be careful. We might add him on the Zoom call if he keeps it up. Now, Mr. Cochran, too, we should point out, you just reminded me, Mr. Pratt, we should also make sure that we thank the Community Preservation Committee, otherwise known as CPC. They too were instrumental on the rental assistance side. And again, we're very happy to say that, pending the final paperwork, we were able to accommodate just about everyone that applied. So that's great news for our city.
Okay, no callers as of now, but we do want to remind folks, if you do want to dial into studio, the number is right there on screen. It's 781-388-9394. We'd love to hear from you calling in studio, but of course, we'll keep looking through social media for your questions as well as on YouTube.
Ron, can you also make a note? You were talking about what Alex was saying. Maybe it's time to make another run at testing. I know we did it. I thought it was a week or two ago. Maybe it's time to promote that once again, using what Mr. Pratt did for rental assistance and the small business grant program. I think you're already doing that, but maybe it's time to do another cycle,
you're referring to multilingual promotion of testing?
Yeah, because I know Mr. Magna was hoping the numbers would be a little bit better in terms of percentage, because it is free. It's in Malden, on Canal Street. So, let's make another push.
Yeah, I'm definitely going to put that in the queue. And actually, special thanks to our last week's guest, Christian Lamphere of Cambridge Health Alliance, who on the heels of last week's call made available to me to distribute the testing flyer in multiple languages. So we're going to share that to our social media to address that. So that's a great point.
Mr. Magna, what should help too, though, is this new program with us and Cataldo, right? Because we're going to be getting in, we're going to start testing in an area we didn't before, right?
I'm sorry?
So we're going to be testing a big swath of the population that we didn't really have access to before, right?
Yeah, so my understanding is they're going to go to the senior housings, the different senior housing locations, starting with 280 Salem Street next week. And I believe we already have 25 people scheduled. So and I don't have a number for that. I don't know how that's going to be, I think that, I'm stuttering here. That's being done by Christopher Webb
Right.
in Cataldo. And I don't know how they're reaching out, but we can find out about that and get that information to Ron and have that put out, and flyers or whatever put in the
Yeah, well,
building.
I think, yeah, he might even do a code red call or something. But let me ask you this, Mr. Magnus. So if we start testing all of those buildings, those tests would count toward the overall total of testing in Malden, right? Just
Correct.
because it's done different by Cataldo and Cambridge Health, they all go into the same testing pool?
Right. So any test done anywhere of a Malden resident will get fed, a positive test will get fed into the Maven system, and then the state disseminates it out to the city of residents.
Okay.
And then we get the count number through the state system.
Okay.
So that's why it takes a little while for it to trickle down
Okay.
for the numbers to get correct.
Okay. All right. Anybody else on there, Ron, or we're going to wrap up early? I think you're on
Yep.
mute.
Yeah, basically a couple of questions, and we'll try to get everybody involved. But again, please, if you can, jump on facebook.com/City of Malden or on YouTube on the stream for Malden Access Television, as well as 781-388-9394 for in-studio calls. So we're waiting for those calls. Our next question is about treatment of COVID-19. So if you have tested, actually, I'm going to make this a twofold. I'm going to bury this. There were two related questions. One is about treatment, and then the other is about the number of cases that are active. First of all, what is there available for treatment if you have tested positive? And a follow-up to that is, how many in Malden are currently active if you are tracing that number?
So that's a good question. So depending on how sick you are with COVID, depends on what the treatment would be. Honestly, the number of cases that stay home and treat the symptoms is vast. I mean, you do hear about the hospitals, how they're not as crowded as they were. People who are hospitalized are the ones who require oxygen supplement. In the worst cases, there are people who require ventilation. There's different, if they have a secondary infection, they would need antibiotics. But conservative treatment for people at home would be Tylenol for fever, and treating specific symptoms that they get. But most people honestly get through it like they would a flu. Anything else would have to go into the hospital, and the treatment would be as how severely sick they are. Active cases, to be honest with you, that would be a number that I don't track every day. It's constantly changing because there are different stages. Probably the end of the month, we'll look at what cases are closed and which cases are what they're calling them recovered, lost to follow up, obviously deceased, and lost to follow up are people that no matter how hard we try, we can't either reach them from the get-go or reach them to find out when a second or third call to find out when their symptoms actually completely went away. So there's certain ways of figuring out where we are in a number of active cases, and some cases obviously last longer than others. So that's the question. The answer is I don't have a number of active cases.
Now, Mr. Magna, I should have asked you this while you were in the web, so maybe the next time you're on the show, I won't put you in it.
Okay.
You agree with the return, these different phases on how we're coming back into the new normal? If you were the governor, would you have done what's been done? Or would
If
you,
I were the governor,
yeah, would you take it a little bit slower? Would you sped it up? What do you think so far?
me, I don't know. I'm very conservative. I
A little
understand.
bit longer?
I understand the need to get the economy going, but you're asking someone who's a medical personnel, so I don't know. I don't know. I think the governor has a very difficult
Right.
decision to make. I think he's got, so I don't know. I think I would have done it just the way he's doing it to try and stimulate the economy. You know, we're doing it very safely. I was just on the phone with my mother before we started, and I mean, she's 80 years old, and she's done. She's lonely. She's, you know, my mother and father. They how can they possibly stay together? That all she wants to do is go grocery shopping. I mean, people want to get out.
Yeah.
It's very difficult. So I get it. I mean, I think the governor's doing a great job. I think you're doing a great job. I think all the people involved are doing a great job. I think it's a very difficult position to be in. Everybody's going to have their criticisms, no matter what the administration does.
Now, Mr. Magna, if we didn't get it right, when do you think we would see this resurgence? So we're in phase 2 now. You know, we just, when do you think you might see an uptick if?
Well, I think the climate of what's going on right now with you know, the protests and everything, I don't think we're going to get an accurate count on what we did, you know, as far as opening and I don't think it's going to be accurate. I think it's going to be skewed because of that. So I still think we're on the 4 to 6 week mark. I don't know if it would have been I think it would have taken longer if we didn't have the gatherings that we did.
Yeah. Okay. All right. Back to you, Mr. Corcoran.
Sure, Mr. Mayor, we do have a caller. So Amanda, go ahead. You are on the air with the panel.
Hi, good evening. I just want to thank you always for doing everything you're doing. I think your job is hard and you're doing a phenomenal job. And my question probably might be tough to answer. I file my taxes every year. It's about the stimulus check. And I went on the website to get my check, and I still haven't received my stimulus check. I don't know if you had a phone number or any advice on how I could follow up on that.
Absolutely. Amanda, stay with us. All right. We'll probably look that up as the show continues to unfold, and we'll announce the number on air. Okay.
Okay. I really appreciate your help. Thank you so much.
So don't hang with us for another few minutes. Mr.
Of
Corcoran,
course.
look that up, and then we'll announce it.
Okay. I really appreciate it. Thank you.
One of the things I can say right off the get-go from personal experience is that if you had not previously had a bank account on file with the IRS for direct deposit, it was delaying the deposit of those checks. So if you had received your refund by paper check in previous tax year, then you're sort of at the last bunch of checks that they would be mailing physical. And the way that my personal experience to overcome that was to actually proactively go onto the IRS's website, irs.gov, and there are links that will pass you through to add your bank account information. You'll have to provide some personal info to match the account. But as soon as I did that, it was only 1 week after I'd done that I then received it. So that's my own personal stuff. I think it's anecdotal, but also, you know, tangible.
But why don't we
I
have
can try again, but when I did that, they didn't let me go through. But I can try that again, definitely.
No, you know what, Amanda? Why don't we have you speak with our congresswoman or the 2 United States senators? Looks like Mr. Duffy might have a phone number for you, so stand by.
Okay. Thank
I
you.
apologize. I was just looking for it. I had it here on my desk. I'll dig it out and give it to you in just a moment.
Okay,
All right.
thank
Amanda,
you so much.
Amanda, we know we can get a hold of you via Facebook because I know you've spoken with us in the
Yes.
in the thread too. So we can just respond right there and get you that information.
Okay, thank you so much. God bless you guys. I appreciate
All right,
it.
Amanda, we'll announce it before the show's up.
Okay, thank you so much. Take care. Stay safe.
All right, you too.
Thanks.
All right, our next question is in regards to the one, the only, the anchor business of all anchor businesses, Bodeborg. What are we thinking for the return of the famous Bodeborg, and how are they doing? What are their plans like?
Well, it's actually pretty exciting because while all this has been happening, Bodeborg has been continuing to evolve their quests. So when they do get to open, which would be slated for June 29th, as long as the numbers continue to go the right way, I think when we walk in there, we'll be really, really surprised at what we see. Not only will they have the expansion mostly built out, but they've turned over some of the quests that were in the traditional space they had. So I see them coming back. And the nice thing about Bodeborg, and my wife and I were discussing this, is that you pick the people you get to go into the quests with. So you do get to isolate from other people when you're in your quest and you're going through it. They're going to have the guidelines and protocols to keep everyone safe. So I think it's actually going to be one of the better things that we could be doing as the reopening occurs.
Now, Mr. Duffy, not that I was ever a quest master, but don't tell me all those people that were on the wall because they completed all the quests are now going to have to do them all over again because they're changing?
We should all hope to get the clock reset back to zero so we have a shot. But I think those people get to stay on the wall, and the new people will just have to do that many more quests to accomplish the same feat.
All right,
We
hats
should have
off.
did it early.
Yeah, hats off to them. All right, so Ms. Duffy, we're going to let you get that phone number so we can announce that for Amanda. Let's go to Ms. Tamagna now. What do we have in the queue for her, Mr. Cochran?
Sure. Let's see here. Going back to one moment here. Oh, okay. I think actually I don't know if we ever got to the treatment part of it. I'm not sure. We did? Okay.
Covered that, yeah. I
Oh,
mean,
I'm sorry.
better give her one because I'm going to ask her one if you don't.
You know what? Go ahead. While I sort myself out here and gather some more questions, go ahead.
I'm going to jump in. So, Mr. Magner, I've asked Mr. Webb this. Let me know your version of how you see school returning in the fall. First of all, do you see that happening as planned? And if so, are you in agreement with some of the precautions that they're starting to announce with kids coming back in?
Well, I know everybody they're working really hard to get a plan in place.
Mhm.
And of course, everything's being, there's all these guidelines being handed down. I don't know how it's going to go at full capacity, but I know they're trying, and I know that's the goal, to get school back. So as long as they're working on it, certainly they're getting all their ducks in a row, and everybody on the committee is doing their best to meet everything that's being, outlined for them to do.
So
It's
with
certainly
your cautious philosophy,
always.
you believe that some of the steps that have been announced, so for instance, I think one thing they're talking about is trying to have meals, lunch delivered to the classroom, those are some of the things that will help.
Well, yeah, but the thing still is that, the limit of the amount of students in a classroom,
Yep.
I don't know how that's really feasible with
Right.
the buildings. I mean, we have what we have to work with.
Right.
So interestingly enough, they have these guidelines set up with, 25% attendance, 50% attendance, 100% attendance. So, are we looking at starting with smaller attendance groups? I don't know. I mean, I don't think anybody, I think I used this terminology before, everybody, it would be great if we all had a crystal ball,
Yep.
we don't. So I think it's just going to have to play out as we all see best fit. And the main thing is, again, the health of the community. What's best for the kids, for the elderly, for all of us. And I think, all in all, we've done a great job. Everybody's done a great job. I think we're all just kind of getting tired of it. And we don't, if we had the magic wand and the crystal balls, we'd wave them and look in them and everything would be done.
Yep.
But that's not the way it is. And there is going to be a new normal and we're going to just have to ease into it.
You still thinking year away for a vaccine, 2021?
I think we'd be lucky if we got it in 2021.
You're thinking more 2022?
I am.
Yeah, okay.
I'd like to be wrong.
Yep. All right, Mr. Duffy, do you have that phone number?
We actually just provided it already, so we're all set.
Okay. All right.
But
Stop winding down, Mr. Cochran?
yeah, we actually have our last caller on hold. But before we do, I'm glad you mentioned vaccine, because I was wondering if when the coronavirus vaccine does come out, will the scene be something similar to what you're seeing on screen right now? I don't know if you could confirm that.
Oh, I can't see it.
Yeah. So
Yeah,
possibly.
you don't
There.
need to see it, Mr. Magna. You know what it
That's
looks
you.
like. Yeah.
Okay. Our last caller of the evening is going to be Robin. Robin, go ahead. You are on the air with the panel.
If I can get.
Hi, Robin.
Hi, hello.
Hi.
Gary. My question is, when is the library going to open and in what form? Between all of the students that have been remote learning and all of us adults who are cooped up at home, I'd love to be able to do a curbside pickup of a dozen books.
All right, Mr. Cochran.
Yeah, we're still trying to trace that down. I think this is a popular one. I'm going to reach directly out to our library director now to see if we can get a response. But libraries are permitted in this phase. However, as we've seen, just because it's instituted in a phase, it doesn't always mean that the organization itself is prepared and ready to go right out of the gate. So I suspect that's what's going on. But I'll confirm that with our library director, Dora St. Martin, to confirm that.
Fabulous. Thank you.
In the meantime, Robin, we did respond to a previous caller, making them aware of all of the great online resources that the library has available. Were you aware of all those resources?
Yes, I am indeed. I don't want to spend any more time in front of a screen than I already am, and I'm just an old-fashioned paper book kind of person. So I'm patiently waiting.
Yeah.
Fair enough.
Same here, Robin. All right. Well,
Great.
we'll let you know once we know more.
Thank you.
And, yep. Thank you. And I know now we're going to start winding down, Mr. Cochran.
Yeah, we're gonna wind down, and first, actually, let's go to Mr. Duffy for the final word from your perspective.
And then we'll go to Mr. Magna, and then we'll wrap it up.
Perfect. So I'm just going to repeat what I said at the beginning, that things feel like the energy's returning. There's a hope. And so you're starting to see this. If people are comfortable with this, I urge you to get out and frequent your favorite places. And then just on a personal note, the other big news of the city, as a longtime resident, I just want to congratulate the mayor and the team that made this happen. We reopened Pleasant Street this week. That's huge. And so when this virus passes, and it will pass, we'll be back to normal, and we're going to have a great downtown that is thriving in both directions along Pleasant Street, that end, and with great new development there. So hats off to you, Mr. Mayor. Thank you.
The other way around, as I always say, Mr. Duffy, Mr. Hogan, Miss Louise, Miss Burke, state delegation, city council, and the list goes on. But we're actually, Mr. Duffy, we're going to end the show with a view of the newly reopened Pleasant Street. But before we do, if people have questions about retail and restaurants, how do they get a hold of you?
So the best way to reach me is email, and it's first initial last name, K Duffy, Duffy, @cityofmalden.org. Half of my questions that I get all during the day is, when can my business reopen? So I help people learn that. And then also the key part, once you can open, is following the guidelines and protocols. So I make sure people have that. If they want to call, 781-397-7000, and I am extension 2009.
Very good. Thanks again.
Thank you.
All right, Mr. Magna, anything you want to close with? Wearing a face mask, doing all the hygiene.
Always out in public, face mask, hand washing, Think about getting tested, asymptomatic or not. Email m2magna@cityofmalden.org. Any questions? Please be patient with the phones. Doing my best to call everybody back. Yeah.
Well, thank you once again for appearing. I want to thank the panelists, and I want to thank Malden Access Television, of course. And most importantly, I want to thank the community for hanging in there with us. I know this has been a long process, but as was stated here tonight, I think we are starting to make progress, and that's because of all of you. So what better way to end tonight's show than by traveling on up the newly reopened Pleasant Street. So Mr. Cochran will lead us out, and we'll see you next Wednesday night at 7 o'clock.
Mr. Mayor, one thing before we break, we did get a message at the last minute for with respect to the library. This is hot off the presses. Dora St. Martin in the library said that next Monday she begins. First of all, her staff is returned. They're catching up on all the old, book returns and things like that. But contactless pickup and reservations, that should all be resuming next Monday. So we're really excited to present that to the two callers. I think it was, we had Robin as well as Patty that both asked that question.
So thank you for that, Mr. Cochran, and thank you everyone once again. We're coming to you from Pleasant Street, literally.
We're gonna try that right now.
Oh, wow.
And yeah, there we are. Well, I'm on Pleasant Street, but that's Pleasant Street alone.